Intravenous fluid therapy is an essential treatment for many ill and injured animals. Intravenous fluid administration is necessary to rehydrate animals that are not taking in food and water, or are losing excessive fluids in the form of vomiting, diarrhea, or respiratory disorders. Intravenous fluid administration is also necessary to replace intravascular fluids when animals have acutely hemorrhaged or are suffering severe inflammatory processes. In this section, you will learn the step-by-step approach to administering intravenous fluids to dogs and cats. Let's first look at some of the materials that will be needed. The following materials should all be prepared prior to beginning the procedure. An intravenous catheter. The type of fluid being administered as selected by the veterinarian specifically for the needs of the patient. A fluid administration set. If the animal is over 20 pounds, you will probably want to use a macro drip set. With this set, 10 drips represent 1 milliliter of fluid. For the animal that is less than 20 pounds, use a micro drip set. A micro drip set takes 60 drops to make 1 milliliter of fluid. 1-inch medical tape. An extension set. A Y connector if multiple fluid bags are being administered. Labels for monitoring fluid levels and additives. A fluid infusion pump or dial-in flow meter. A Buretrol set. This serves to limit the amount of fluids being administered. They also allow for the addition of other drugs to the Buretrol without altering the bag of fluids. This is especially helpful when varying amounts of drugs, such as dextrose, will need to be administered. Before starting, it is important that you wash your hands thoroughly. Remove the fluid bag from its protective plastic covering and then place a flow meter adhesive strip or a piece of 1-inch tape along the outer edge of the fluid bag. A Sharpie can also be used to write directly onto the bag. Write the date and starting time on this strip, as well as the bag number. You will need to mark the top of the fluid line with a pen or marker to indicate the starting point. Additives such as dextrose, potassium chloride, and others are sometimes injected into the fluid bag depending on the individual patient's treatment. When medications are added, you will want to shake the bag to distribute the additives. An additive label is attached to the fluid bag indicating the amount and type of additive, the date, and the time added. Each label should be initialed by the person preparing the fluid bag. Attach the fluid administration set to the fluid bag using sterile technique and attach an extension set to the administration set, also using sterile technique. If multiple fluid bags are being administered into one intravenous catheter, a Y connector line can be attached to each fluid administration set. Compress the chamber at the top of the administration set and partially fill it with fluid from the bag. Some chambers will have a line that indicates where to fill the fluid to. You will now need to open the fluid line by opening the clamp and removing the cap. Allow fluid to completely fill the administration extension line and then close the fluid line once fluid passes out of the open end. It is important to never touch the exposed end of a sterile line or catheter. Inspect the line closely for any air bubbles. If air bubbles are present, reopen the fluid line and allow the air to flow out. If air bubbles are near the top of the line, you may be able to force them up into the chamber by holding the bag above the line and tapping the top of the line. Attach the end of the extension set or Y connector to the intravenous catheter using sterile technique. You will now need to secure the tubing to the animal's limb. Use a stress loop applied to the limb using 1-inch tape, as shown here. Use the 1-inch tape to wrap and secure the tubing of the patient's limb, being careful to avoid any kinking of the line. Although the catheter should be well secured to the limb, use caution as not to tape the leg too tight, as this can cut off the animal's circulation. Next, place the fluid line into the fluid infusion pump as directed by the manufacturer and set the drip rate and volume to be infused as indicated by the veterinarian. Open the fluid line and start the pump. Many pumps are equipped with alarms that alert you if the flow has stopped or if the patient is out of fluids. The fluid line is then opened and the drip rate is set to administer the volume of fluid desired. These pumps offer a distinct advantage in that they infuse a calculated amount of fluid over a defined time period. They also overcome many of the positional obstructions that occur with gravity-based fluid administration.